CBS News Colorado is with the Senate candidates discussing mental health as voters decide.
Thank you for joining us today for the Meeting of the Minds U.S. Senate Candidate Forum on Mental Health. It's hosted by Healthier Colorado, Children's Hospital Colorado, Inseparable, and the University of Colorado Anschutz Medical Campus. This is a first of its kind, nonpartisan forum where Colorado's candidates for U.S. Senate will take up the issue of mental health, an issue that crosses party lines.
We need to treat mental health as seriously as we do physical health. That means integrating physical health and mental health together. It means making sure we go to where people are, like their schools, like their workplaces, to make sure that we're really integrating mental health into people's lives.
The issue of mental health is deeply personal to me. At 14 years old, our daughter lost a very close friend to suicide. Our niece, just 4 years ago, lost a fiance to suicide on Christmas Day. And I don't know a family that hasn't been affected by mental health. My heart breaks for the young people of the country who are going through their struggles. We're failing our kids, and we have to do better. What's happening in America is not working. Partisanship is poisoning our country. Well, if we put a massive focus on these issues and we reprioritize our values, and we can turn the ship around. We lead. We do what's right by our kids. This debate is long past due, but it's about priorities.
Integration of mental health and physical health has to be the goal.
There's barriers, though, to what we're doing for mental health. First of them, one is a workforce problem. We've got to get training to counselors, therapists.
If we're actually going to have parity, Medicare is going to have to reimburse those sorts of things. We've got to decide that we're going to invest in the American people again, and that's long overdue, and that's what we need to do.
My God, why aren't our priorities on mental health? Why are they focused on education for our kids? Why aren't they focused on those things that are important to working Americans?
When a call goes into 911, they make a decision. Are we going to send mental health workers? Are we going to send a cop with mental health workers? Or are we just going to send police officers? And in about 9,000 instances where 911 has dispatched mental health people, they've never had the need to send backup, which means the police officers can focus on violent crime, and hopefully people can get the help that they need and are less likely to be at risk for suicide or other kinds of trauma.
We need to have that same type of apprenticeship program available to healthcare workers, available to counselors, to therapists. Put them in a situation where businesses can sponsor them so they're getting paid while they're learning. Make sure that the 4-year and the 2-year colleges, that those two curriculums line up so that when they transfer from one school to the next, they're not losing credits. We start at that level and we begin to grow a workforce, and that's how it starts, and that's how we get them into our industry.
We're not paying people enough in these jobs, and we're not embedding their training enough and showing them a path forward. I think that's something that we could do. The stress that children feel, in these low-income neighborhoods, in schools where there are no mental health services, is traumatic. And it creates PTSD among children and their families. And we've talked a lot about this over many years. We've never done anything about it. Now we're finally beginning to do something about it. And I look forward to continuing to work with Senator Cornyn from Texas to be able to figure out what the next 10 years is going to look like.
Like all of you, I'm worried about the direction this country is headed, and we need change. We need change in leadership. We need change in focus and priorities. And let's stop the reckless spending and direct it at our kids, our youth, our young adults to help with the access to education for all zip codes. Access to mental health services and treatment, prevention and early intervention of mental health challenges before kids are in a crisis.
What more we can do to make sure that we're integrating, we're changing the incentive structures in our programs so that we're integrating physical health care with mental health care so that we're getting to where people are, as I mentioned, our schools, our workplaces, our churches, and other places. And so we're changing things like the way the Medicare program works so that people actually do have the benefit of mental health care, which today they don't.